We are now live on all our social media channels. We can start. And Dr. Rasha is on her way. She'll be joining us very shortly. In the meantime, can we kindly have one of the teasers played, please?
Join me for Merck Foundation Livestream on Facebook, together with leading African health experts, to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Mpox. What is it? How does it spread? And how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck Foundation live stream on Facebook, together with leading African health experts, to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Jenny, Dr. Brian is here.
How does it spread and how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck Foundation live stream on Facebook, together with leading African health experts, to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Mpox. What is it, how does it spread, and how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck Foundation live stream on Facebook, together with leading African health experts to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Mpox. What is it, how does it spread, and how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck Foundation live stream on Facebook, together with leading African health experts to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Mpox. What is it, how does it spread, and how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck Foundation live stream on Facebook, together with leading African health experts to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Prepare to know more about monkeypox virus. Join me for a Merck Foundation live stream with leading African health experts to dive deep into the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips, we got you covered.
Mark your calendar. Hit that reminder button and don't miss your chance to ask questions live. Subscribe now and tune in live to stay informed.
Mpox. What is it? How does it spread? And how to be safe? Got more questions about Mpox? Join me for an exclusive Merck Foundation live stream on Twitter with leading African health experts to deep dive into Mpox. This Thursday, 5th of September at 2 p.m. Dubai time. Retweet, spread the word, and join the live. Don't miss it. Join me for Merck
Good afternoon, everyone. Thank you so much for joining us today. We are starting shortly within next 2 to 3 minutes, so please be with us.
Join me for Merck Foundation Livestream on Facebook, together with leading African health experts, to know everything about the monkeypox virus. Whether you're concerned about symptoms, curious about how it spreads, or looking for the latest prevention tips. Make sure you follow us, join our live stream, and ask questions live or drop them in the comments below, and we'll answer them live during the session. Hello? Good morning.
Good morning.
Good morning, Rasha.
Good morning. Good morning. Welcome to our
Good morning.
Good morning. I will start our live stream. This is our first live stream that streamed on all our channels, Facebook, YouTube, Twitter, which is X now, and Instagram. And I already was important because of the new issue or health risk that been announced recently by the global health like risk by the WHO, Mpox. And of course, since our main objective of Merck Foundation is raising awareness, community awareness, building advocacy, and advocating for health and global coverage and universal coverage. And as we acted during Corona by also raising awareness across our social media, I thought that we start to also address Mpox as a global health risk, and start to build advocacy, separate myths from fiction and from facts, and also raise awareness, because awareness is very, very important. Access to knowledge and information is very important, even for people who specialize in health, like myself. I am a pharmacist, and I also work as a CEO of Merck Foundation. Still, there is a lot of questions I need to be answered, and a lot of issues I need to take care of, since I am traveling with my team across Africa and across the world, because it's not only in Africa, it's already global. So we need to have some sort of guidelines, safety and health guidelines, especially when we are conducting the big events and programs and meetings, especially the next conference that we are holding in Tanzania. So we need to take care of our guests. So therefore, I said this is the best time to invite the healthcare experts of Africa, who will answer all our questions. And no one, I think, in my opinion, can answer these questions better than them, because they are specialized in infectious diseases, and they are specialized in infectious diseases in Africa, which is the best specialty, or the best specialized in the world that for infectious diseases are African experts, because of the experience and the exposure and the hands-on all the time. So I would like to welcome with me Professor Andrew Kambugu, the Executive Director at the Infectious Institution, IDI, and College of Health Sciences, Makerere University, Uganda. And I would like also to welcome Dr. Samuel Hamadi, Director Center for Virus Research, KEMRI, representing Professor Elijah Songok, Director General of Kenya Medical Research Institute, Kenya. And of course, welcome Professor Opina Onwojikwi. I hope that I'm announcing the name correct, but you will correct me later. Professor of Health Economics and Policy and Pharmaco-economics and Pharmaco-epidemiology departments of Health Administration and Management of Pharmacology and Therapeutic College of Medicine, University of Nigeria. And Professor Hamisi M. Malibu, Chief Research Scientist and Chairperson of Traditional and Alternative Health Practice Council, Ministry of Health, Tanzania. And Dr. Brian Tigo Mo, Medical Epidemiology and Genomics, CDC Foundation, Cameroon. And Dr. Bismark Opoku Asare, Infectious Disease Consultant, Korle Teaching Hospital Infectious Disease Center of Ghana, and Dr. Mangala Sonzi Donatien, a specialist in internal medicine, infectious disease specialist from the Democratic Republic of Congo. You can see the presentation of our African experts across the continent, French-speaking countries and English-speaking countries, East, West, and South. So I'm very happy to have you with us and to help us raise awareness and inform people, so we can actually contribute to limit the transmission of Mpox, because if we take care and we help prevention and also early detection and isolation, this will eliminate the fast spreading of Mpox. And I would like Merck Foundation and us to be part of this mission. Sorry, I have to put this on silence, as you know, and I advise everyone to put also the mobiles on silence. And for all the audience, there is interpretation for French and English and Portuguese. It's available on the globe interpretation on the bottom of the screen of Zoom, so you can also listen to your favorable and language and a native language. So doctors, professors, welcome to our live stream. And I would like also to welcome all the audience, either on the Zoom from our alumni and media partners, or on the social media viewers and our followers. And I really ask you to also share and post and repost and share and like and all these things you do, subscribe and all this. So it goes to every one, and we spread the word and we spread our awareness. Of course, why we are addressing this? Just quickly, Mpox has been announced as a global health risk for important several reasons and suddenly, and it was a surprise of us when we saw that we are already recovered from Corona and everything coming back to normal. We still have this little concern, but we need to know from our expert if this concern, we have to take it serious or is going to be more than what's now or not. The rapid spread beyond the endemic regions, this is the reason why it's become health risk, and also human to human transition, which is increased by increased rates than it used to be before, because maybe the lack of vaccination, because many people in Europe and West world stopped the vaccination against smallpox. Maybe also this is a reason. I'm not sure. We will know more from our experts. And lack of immunity in the global population, this is what I said, and potential for several diseases and strain on healthcare system, of course, and we don't need that in our life at the moment after Corona and all the economic decline after the shutdown and the lockdown and all this, as we know, and the risk of further mutation. Global travel and connectivity, which I am suffering from, and public health preparation or readiness. So all this is need us to address it in a different topics, different ways, and different strategy. So I will start my questions so we can start our live stream. And also I address all of you to send me your questions, and the team will be messaging me your questions so I can discuss it with our team and our experts. Okay, now my first questions will go to Dr. Andrew Kambugu. Can you explain what Mpox is and how it differs from other viruses like smallpox and chickenpox? Because we all know smallpox and chickenpox, and we had the vaccination already for them. So is this the same or different, and how different?
Great, Raja. Can you hear me before I start?
Yes, I can.
Yeah. Thank you for inviting me to be part of this. I may be leaving soon, so I'm glad you asked me the first question. So, Mpox is the disease that is caused by a virus that is called monkeypox. I think one learning point for our audience is that the disease itself used to be called monkeypox disease, but in November of 2022, the WHO decided to I think that there's now an expectation that we shouldn't name diseases after animals, and therefore not be stigmatizing them. Yeah. So it's very important to understand that the disease is called Mpox, but the virus is called monkeypox.
Yes, true.
So Mpox is caused by this virus. I know there are many virologists on this call, people who specialize on studying viruses. So there's a group of viruses called orthopoxviruses, and monkeypox virus belongs to this group. All of us are familiar with the virus called smallpox. So it also belongs to this group. So you can say that the monkeypox virus and smallpox are like cousins.
Yes.
This relationship is important because actually the way Mpox presents looks quite similar with the way smallpox used to present. So patients present with these macules and papules on the skin. Also, if you look at these two viruses under the microscope, you may not be able to distinguish between them. So I think in summary, the Mpox virus is quite similar to the smallpox virus. Now, Rasha, you also asked about chickenpox.
Yes.
The interesting thing is that chickenpox belongs to another tribe of viruses, the herpes virus. Many of us are familiar with herpes viruses. For example, herpes causes a lot of genital ulcerations. So there are those herpes viruses, including the viruses that cause cervical cancer and the viruses that cause Kaposi sarcoma. So those are different viruses. So in other words, chickenpox is, the name might mislead you to think that it's related to smallpox or to monkeypox, but they're different. So I think before I hand it back over to you, just to say that this virus was initially isolated from monkeys in the 1950s. The first case was in Denmark in a lab that was doing polio research. And these monkeys developed a disease, and eventually the virus was identified. And it was noted that it really looked similar to a smallpox. Since then, there were a number of outbreaks, mostly in monkeys in the 70s. And then the disease was eventually seen in human populations, mostly in the Democratic Republic of Congo. And then in 2022-23, there was a global outbreak. And so that's why it's very concerning that we are beginning to see what is an emergency of public health concern. I think the final thing I will say, Rasha and colleagues, I think one of the things to reflect on, especially we in Africa, is one, we know that the smallpox vaccine is effective against monkeypox.
Yes.
And maybe the case that we're seeing this escalation in monkeypox because, as you know, smallpox was eradicated and people were no longer receiving the smallpox virus. The second consideration is that we have a significant population of people living with HIV. And also Africa has many young children, people under the age of 15. And we have seen from the current outbreak that being young, being under age 5, but also living with HIV, if you are not biologically suppressed, are risk factors for higher mortality. So I wanted to emphasize that this is really why in Africa, we need to pay attention to Mpox from a public health perspective. But thank you for having me.
Dr. Andrew, before you leave, thank you very much for this. I just one question to comment on your answer. Is Mpox stronger than smallpox in the way treatment, symptoms, is more risky, more dangerous, or the same or less?
The good news is that Mpox, in terms of the mortality rate, something we call the case fatality rate, is milder generally. So I think that should be good news. But also in terms of its transmissibility and spread. So we know that smallpox was a very infectious virus.
Yes.
So Mpox is infectious, but we know that it requires more person-to-person contact for transmission. And I think that is good news.
Yes,
but
definitely.
Nevertheless, because we have a young population, we have many people living with HIV, we really need to be very concerned about Mpox. Thank you.
Definitely, definitely. Thank you very much, Professor Andrew. Professor Andrew, are you going to be staying with us a little bit, or are you leaving?
I'm leaving now, but once I come back, and actually I need to go because it's Mpox related. We have an outbreak.
Oh, wow. Okay. Maybe you can come back and tell us about it.
Yes. So
Please.
I'll endeavor to come back.
Because it will be very informative. We have a lot of followers on social media from across the globe. We have 6 million followers, and a lot of them are listening to our live stream. And we want to make the best benefit and information, access to information for all of them.
I will make an attempt to come back. Thank you so much.
Great. Thank you very much.
I want to say hello to the other panelists. Thank you for joining.
Thank you very much. Thank you. So thank you, Professor Andrew. And now there is other question I am especially concerned about is before the question I'm concerned about, let us have a small introduction about Mpox more. I know that Professor Andrew gave us like an overview, but I want a little bit more detail about the commonicity, like how common is Mpox in Africa, and was it common or historically spread in any other continent? Like now I hear that there's many cases in Europe, there's many cases in US, in Asia. So what happened? Is this only because the two factors that has been, or because we are mobilizing around and traveling around the whole world, not like before? So this question can be addressed to Dr. Samuel Hamadi.
Thank you so much. And as you introduced, my name is Dr. Samuel Hamadi. I work with the Kenya Medical Research Institute, and I'm representing our...
Dr. Elijah. The voice is gone. I think it's muted.
Our director,
Yes.
Professor Elijah Songok. Yes, so the Mpox virus, I think, has been there in the past. And as our colleague has said previously, like what we have read also in literature, that it was first identified in monkeys that were being used in lab research work. And then in the first cases were reported in the early 70s in the Democratic Republic of Congo. And even as we continue to move to areas to urbanize most of our areas and moving to forest areas, we are going to see more of these viruses coming out. But just to answer your question is that Mpox is not, I must say that it's a recent virus. And it has come out more specifically because of the eradication of smallpox. And when we stopped vaccinating our people against smallpox, that's when we started hearing of cases of Mpox coming around. So Mpox is not an old virus, as you may say, although its origin, is said to have come from around Democratic Republic of Congo. It's not really known about the origin. So the speculation is that it has come from West and Central Africa. So what we can only say is that now we are coming to know more about it because it is infecting humans. Probably it was mostly in animals, and now because of the issues of lack of vaccination of people against smallpox, it has taken opportunity of that the lowered immunity in people. So maybe to answer your question, I can just say that it's not an old virus. I don't know if I've answered your question.
Yes. So why do you think that we stopped vaccination for smallpox? Why we did not continue? Because we know that these things can come back.
We stopped vaccination because smallpox was eradicated. Vaccines are very expensive. And so if something is not there, you probably say then you stop vaccinating. But the lessons we are learning from polio is that when you eradicate something, it's important for you to continue monitoring.
Exactly. Definitely.
So my thinking is that, like especially in Africa, we should continue with the vaccinations against these infectious diseases. And it's a lesson we have learned from COVID, because with a vaccination of smallpox, you get cross immunity against viruses like Mpox.
Yes.
And one of the suspicions we have even for COVID, why Africa was not so hit so much, is because in Africa, people are normally vaccinated against many infectious diseases.
Yes.
There are chances of cross immunity. And therefore, the lesson we are learning is that it's important that we continue with vaccinations and monitoring, doing surveillance, because that is one of the gaps that we have in Africa. So surveillance is very key to ensure that even if we are vaccinating, we continue vaccinating populations that are at risk, because if we were doing this maybe for Mpox, we wouldn't have what we are talking about today.
In fact, it should be vaccination to everyone, because people are traveling and there is no, now it's a global world. Nobody will have his disease in his country, and it will be around once it's infectious. The golden question from myself at the moment, I am vaccinated from smallpox, but this is 52 years ago because I am now 52. So is this going to be still active or what?
So the other lesson we are learning from Mpox is that right now we have the Mpox we had in 2000 and 2020 that caused that epidemic then is different from the Mpox that we have now, because now we have Clade 1A and Clade 1B and so forth. So the important thing is just to make sure that if there is vaccination, that we get revaccinated. We shouldn't assume that the vaccinations we got previously will be protective. So
is there any vaccine available now or not yet?
So unfortunately, most of these vaccines are not available in Africa. There are countries that are holding them out there. And so the important thing is just to make sure that these vaccines are available. And however, because of the gap that we currently have, my thinking is that we should just vaccinate our people against the smallpox vaccines, even as we wait for other vaccines. But again, what we can do because of lack of the vaccines is to vaccinate target populations, like the healthcare workers, the people who have challenges, like especially young children, because the immunity is not well developed, and other people who are at high risk of infection, like people who are truck drivers, because like in Kenya, the cases that we are seeing are mainly of truck drivers who are coming from other places. So we can target those populations because the vaccinations are not available. So you cannot do mass vaccination for everybody out there.
Yes, definitely. Thank you very much, Dr. Samail.
Welcome,
Professor, thank you. Professor Obina, my vaccine 52 years ago, or people, or even they have the older people like 60 and 70, and they take the vaccine when they were infants because it was mandatory for everyone, even across the globe. Are we partially protected more than the people who did not vaccine at all? Do we need an activation dose or to be re-vaccinated, or it will be dangerous for us because also too much vaccines in the same disease could be actually be infectious more than I think so. So can you please explain to me more, because this question came almost 1,000 times to us. And I want to be more elaboration. This question, I want to address it to all the professors, because it's a major question for everyone who in my age and younger and older, and they are traveling frequently and they already have got the vaccine when they were kids. Yes, Doctor? Professor Obina?
Yeah, so if I got your question right, I mean, you're asking whether if somebody has been vaccinated with, is it chickenpox?
Smallpox,
Vaccine?
smallpox, yes.
Smallpox. Well, I think it's difficult to find. I mean, I was never vaccinated for smallpox. It's difficult to find the age groups that are vaccinated with smallpox. But then I think we need more research. I mean, we can't just go and say, oh, because you're vaccinated with smallpox vaccine, it covers for Mpox. I think the simple answer is that nobody knows. So that's where research has to come in. We need to generate the evidence. Otherwise, we'll just be guessing. So, so it calls for immediate research in this area to find out whether there's some cross immunity. But I think the answer, nobody will really give you that answer based on evidence.
Because they said the reason of the spreading, the fast spreading of Mpox at the moment, that people stopped vaccination. So the opposite of that is supposedly the people who's vaccinated should be protected.
Yeah, but we don't have the data. Nobody has published, shown the data, the level of protection on people who I guess will all be over 70-year-olds, people that will have these smallpox. Because I mean, we know when smallpox was eradicated and the vaccination stopped. People that will have that were vaccinated will all be above 70 years or 80 years now.
No, I am vaccinated. I am 50.
All right, you're lucky then. In Africa,
yes.
we're not vaccinated.
I still have it. It was here. You know.
Yeah.
So
Yeah, but the bottom line is that we need evidence. We need to study it, to be able to provide a clear advice about whether smallpox vaccine protects against Mpox. And we don't have that evidence right now. But it's an area that calls for, very rapid research to be commissioned.
I think the only research, which is, of course, observational research they have done, all the people who's infected by Mpox, they were two categories, either not vaccinated or vaccinated but have HIV. So that's why they came to the conclusion of this. This is what I read.
It's a very weak conclusion. One of my professors
conclusion, but it's better than nothing, because we are all worried. Yes.
He always says no control, no conclusion. So it's let's get hard, fast evidence to support.
But how long it takes to make this research that you're asking for? I mean, we are in a hurry. We need to know.
Yeah, I mean, if it's commissioned, like we had this solidarity trial during the COVID. All we need is to generate the protocol and get people to into a solidarity research, and it can happen 3 months, 6 months. I'm sure we'll have the answer.
Yeah. Okay, great. I'm sure that some people doing this at the moment. Professor Hamisi, are you here? Yes. Professor Hamisi, I want you to answer the same question from your point of view, because I read too many opinions about this, and this is a golden question. Why golden question? Because it's being sent to us by several people, maybe 1,000 questions. So can you please also help me to answer this with regards to the people who's vaccinated, how many years is the vaccine can be active for, and is there, do we activate it by activation dose or a new vaccine totally? What? Dr. Hamisi?
Thank you very much.
Yes.
In the first place, let me thank you and other panelists for setting the ground.
Yes.
When it comes to vaccination, what are we targeting with vaccination is to activate the body to produce antibodies against a target protein. And the effectiveness on how the body produces those antibodies is also not uniform. We respond differently to antigens. And quite a number of research have shown the possibility of at least 4 results after introduction of a vaccine. There are those who will respond well. Their body will produce enough antibodies following activation, following with the challenge of the antigen in the vaccine. The second group will respond partially. So will produce little antibodies, though they will be protected. The other groups might be affected by the antigen. They can show some side effects or develop part of the disease. And there is a group who won't be responding to the antigen, and they will produce any antibody. Though those who are not responding well, they are always fewer, less than between 1 to 5%. Now, people getting disease after being fully vaccinated is not new. It is because of this scientific phenomena that when you are vaccinated, you don't know the reaction of your body, if you are fully protected or partially protected by the vaccine. But what is important, if large segment of the population is vaccinated, it means that the protection is extensive and the community can reach what we call herd immunity. Now, those who were vaccinated against smallpox, it is very important to have a booster vaccine dose because that one will ensure that you have enough antibodies against Mpox. Because you don't know, did you fall in which group? Whether the group which could not produce antibodies at all, or the group which partially produced the antibodies, or the group which fully produced the antibodies which actually receive life protection. Because of that, we need to revaccinate. Thank you.
Thank you very much. There is no any test to test how much antibodies you have for a smallpox or pox group.
Yes, at the moment, with the development in biotechnology, there is quite a number of tests which can be employed to measure the level or the titers of the required antibodies if your body have produced enough antibodies which protects you full, or you have lower titers of the antibodies. At present,
you have test
as advanced, we have the tests.
You don't have it now, test?
No, the tests are available.
So
Even with COVID.
When I come to Tanzania and after 2 weeks, I come to you and you test me for the antibodies?
Yes, at the Muhimbili National Hospital, we are well equipped.
I'll come to you.
We do all those tests.
Because I'm coming to Tanzania.
Tanzania is well equipped.
Yes, I'm visiting
we
Tanzania.
are also among of the advanced countries.
Oh, fantastic. So I will come to, I'm coming to Tanzania and after 2 weeks, and maybe I can get tested for the antibodies there.
I will be glad to host you in Tanzania.
Thank you.
You are warmly welcome.
Thank you. Thank you very much, Dr. Hamisi. So,
okay, you are welcome.
Yes, thank you. Thank you. I'm very happy with this discussion because every scientist and professor in our panel add a bit from his experience in a different angle and different light of the same question, which is our golden question. So, Dr. Brian, I would like you to also, if you don't mind, answer the same question with regards to vaccine.
Yeah, can you hear me?
Yes.
Oh, awesome. Great. I just wanted to point out, just follow up with Dr. Hamisi said, we don't know what the correlates of immunity is. Correlates of protection is very important. So what that means is we don't know what the implications of having neutralizing antibodies are. Whenever we have an emerging disease, it's important to know what the correlates of immunity is. Neutralizing antibodies could be one of those. It could be cell-mediated immune response. So our immune system is divided into two. We have humoral immune response, that's characterized by the production of antibodies, and we have cell-mediated immune response. And again, within that category, there's a huge group of cells that are implicated. What we don't know is what the meaning of the rising and lowering of the titer levels. When the Mpox outbreak started in 2022, as you pointed out, there is a hypothesis that it's because we stopped vaccinating against Mpox and the disease explored an immunity gap. So these are hypotheses. So we don't know. It could be that the virus has mutated within animal hosts and has gained the ability to transmit human to human. Those are scientific questions that are still not known. I think it's an area where we need a lot of research in, because we haven't done a lot. There's as far as I know, that we don't typically measure. We don't do any ELISA tests to measure how many antibodies a person has to determine whether or not they need a booster or not. That's another area of research. A lot of people were vaccinated during the 2022 outbreak, but we don't know if the vaccination they received 2 years ago would confer immunity against this new clade. So I also wanted to emphasize that we have two main clades of Mpox. There's one that has been endemic in the West African region. It's called Clade 2, and that's and a subclade of it was what drove the 2022 outbreak. That's Clade 2B. That's what was responsible for the global outbreak we saw in 2022. There is a second clade that's found.
Question, Dr. Brian. In 2022, there was another outbreak from Mpox?
In 2022, we had an Mpox outbreak that was primarily driven by Clade 2B, which has been characterized now, which was historically known as the West African clade. So,
okay, and it goes around the whole world also, or it was only in West Africa, like you said, or
it had been endemic in West Africa, but it spread. So there's, again, a lot of hypotheses there. Is it because it had this new mutation called the ApoBec2 mutation that facilitated human-to-human transmission? Or was it just that the virus explored a new way of transmitting, a new sexual network? Because most of the transmissions was characteristically between among men who have sex with men. So is it because the virus has explored a new way of spreading? Is it because the virus is mutating? So this, again, highlights the importance of genomic sequencing. It's very, very important for us to enhance and build very robust genomic surveillance capacity. And not only genomic surveillance capacity, epidemiological surveillance is very important. We need to have the ability to have as much robust and granular epidemiological data in order to answer those questions. So there are two clades. So when we talk about Mpox, there are really two characteristics, and those two clades are very phenotypically distinct, and they are genetically distinct. They have different sets of mutations, and the World Health Organization just released a document about a week ago where they try to distinguish how the lesions from Clade 1 differs from the lesions in Clade 2, and also the lesions in Clade 1 and Clade 1A and Clade 1B, and how those are very distinct from the lesions with Clade 2A and Clade 2B. So, so I think that's one point there. We have two different clades. So what we saw in 2022 was primarily Clade 2B. What we are seeing in Africa right now, which led to the Africa CDC declaring the public health emergency of continental security, is the surge in Clade 1B, primarily in the DRC, even though we are seeing sporadic cases of Clade 1A in different regions in Africa, but it is primarily Clade 1B. To answer the question around...
One question, because I don't want the social media viewers, which is common, like not scientists or doctors, to understand what is A and B. We don't know anything about this. What is the difference?
So when we have a virus, we tend to sequence. The sequencing means we try to read the genetic material that's found in the...
I understand this, but what this means to us as a people, as normal people. You had the Mpox. How do you know it's A and B? And what is the difference in the seriousness, severeness?
So you can think about different clades as different variants. During the COVID-19 pandemic, we had different variants like Alpha, we had Omicron, we have Delta, different clades. And the main difference here is the mutations, the accumulation, the constellation of mutations that each of these clades have that has led to classifications in different subclades, as we say. So just think about clades as variants, as we use that term colloquially during the COVID-19 pandemic.
Okay, and which one is severe? The one we have now or the one we had in 2022?
We don't know. The World Health Organization is collecting a lot of data, but the overwhelming amount of most of the cases in Clade 1B, Clade 1B is more severe than the cases than Clade 2. So Clade 1 has a much higher fatality rate than the
one we have now has higher fatality rate.
Yes, has a more higher.
So the mutation was to the worst, not to the best, to the less, because in Corona, the mutation was going to weaker virus, but you telling us now the mutation is going to a stronger virus.
Yeah, so when we had the 1B mutation, or at least the 1B clade has always been in Africa. It's not that it just didn't lead to that surge. And again, it's likely that the mechanism of transmission primarily has been zoonotic.
Yes.
So with increasing globalization, you mentioned earlier that you're traveling a lot, increasing globalization, we are destroying the environment, we are deforesting. So the closeness that humans are to animals, the more likely we are to experience zoonotic spillover events. So viruses that normally habitate in animals are more likely to spill over into humans. So zoonotic transmission is likely going to happen as we become, more globalization, more traveling, more destruction of the environment and things like that. So those kinds of events are expected to continue to happen. We just need to build very solid surveillance infrastructure, particularly in Africa, to help with the to really help with the surveillance of these kinds of events.
Definitely. Thank you very much, Dr. Brian. I will address the same question to Dr. Bismark. Are you here?
Yes, please. Thank you so much. I mean, I want to thank all my colleagues as well for a very informative session. I've personally learned so much from everybody as well. Yeah, so basically, I mean, there are some studies that have been done in the past that show that if you've had smallpox vaccination in the past, usually between 15 to 20 years after you've been vaccinated with a smallpox vaccine, usually you begin to lose your immunity after 15 to 20 years. So it's unlikely that those who had the smallpox vaccination about close to 40 or more years, because I mean, I think the World Health Organization declared smallpox eradicated in 1980, and because unless for research purposes or where there are issues with bioterrorism and all that, not much research is going into smallpox vaccination any longer. So like my senior colleagues and some of my colleagues have said, there's certainly a need for further research into this area. But the rule of thumbs now is that if you have had this smallpox vaccination in the past, over the last maybe more than 40 years ago, you possibly do not have much protection against monkeypox.
Thank you very much for making me very happy now. This is completely destructive. I was thinking that at least I'm partially protected, but no. Okay.
After 20 years, it's unlikely. So whatever preventive measures you need to take, it will be advisable that you take them. Okay.
Yes.
Yeah. Thank you.
We will come back to the prevention and all the measures we want to take. But we will finish this first with Dr. Mangala Sonzi from Congo, DRC Congo. Please tell us, address the same question with regards to the vaccination and the protection. Dr. Mangala? Are you here? Mahak?
Dr. Mandala has, I think, dropped out.
Okay, no problem. We'll come back to it.
Yeah.
So, okay, the second question it kept coming as well is, what are the main ways Mpox spread from person to person or from animals to human? And how and when exactly? So I understand that there is an incubation period, and then after that, the symptoms start to appear, and then the lesions start to appear. And since it's from human to human, and also from surfaces, and so I want to know the ways of the spreading and the infection from person to person, how it happens, and then also from person to surfaces, like for example sheets and towels and surfaces and so on. When exactly the patient will be able to transmit the disease to another person in the stage of the cycle of the disease? So we can address this question to Professor Andrew is not here, so we can have Dr. Samuel. If not, then Dr. Hamisi. Dr. Hamisi, yes.
Hello.
Hi.
Hi, I'm back again.
Yes.
Yeah, thank you very much for giving me the floor. When it comes to Mpox, you have given the whole of the introduction that after the blisters have burst and released the fluids from the contact,
yes,
anyone can get Mpox. This is very important to note, and it spreads from contact with infected person. This could be from touch, kissing, or sex that it can transmit. Also, it can be from animals. When hunting animals, the process of skinning, processing game meat, and cooking them. During the process, one can be infected.
Cooking them.
But materials like contaminated bed sheets, clothes, needles, or home utensils, touchy surfaces like a table, door handles, taps, all touchy surfaces can transmit the disease so long as an infected person have touched the place before. Another very possible pathway is from pregnant mother to children, because pregnant mother can transmit the virus through the womb to the child. So these are the principal pathways whereby transmission can occur. When we mention of touch surfaces, could be tables, could be chairs, whereby an infected person have touched.
Hotels, towels,
in the hotel, in the transport, an infected person can touch a chair or any touch surface in a vehicle, in a bus, in an aeroplane. All those can transmit the infection.
Thank you very much. This is again, it's everything. So the question is the infected person, he will have the strength to go and travel, or he will be bedridden because he feels very weak and he cannot move?
No, that is very important, and this is an important question.
Yes.
An infected person, depending on his body immunity, can be very weak and able even to walk, can have partial disease because of the superior immunity. And those who are having partial diseases, actually they are able to transmit the disease. And please note that those who are getting severe disease, they are about 5 to 10% of the infected. 90% will get mild disease.
And they will
those
be
who
going
will get
around
mild disease, yes, they can walk around. That's why isolation and quarantine is very important during the outbreak of this infection.
How would I know the person in front of me is infected by the Mpox? How can I see when I see him that done, I'm not going to touch and I'm going to leave? How do I know? What is the sign?
Actually, the major signs of Mpox, it is the swelling of lymph nodes.
Okay.
Lymph nodes.
I can't see the lymph.
Because other signs and symptoms, they are also common to other infections, other febrile infections like malaria, typhoid, and so forth. But the swelling of lymph nodes, the lesion, comes later. But the swelling of lymph nodes will happen at an earlier stage, and you can know that it might be possible that you have Mpox. And when the lesion
Infectious at this
develops,
stage, infectious as the swelling stage, or only from the lesion burst?
because once you have the swelling of the lymph nodes, it is a major sign that Mpox is developing within you. And when you see the lesions, now you have the full-blown disease.
And when he's infectious, the patient, when the
After the rupture of the blisters,
so I will know.
that is where you become infectious.
Then you will identify this person when he has too much lesions. You understand he might have acne or Mpox.
First of all, when you have swollen lymph nodes, you have fever, you have all the signs.
No, I will
clever
not
person can postulate that.
No, I am talking about if I'm going, for example, in a place meeting new people, in a conference, in a place, in something, and I see people in front of me, so I don't know if
once you develop blisters, because
yes.
anytime the blister will burst, you are not supposed to go out. You have either you can isolate yourself inside your house and have a treatment. You can call healthcare facility. They can come for you with an organized ambulance to take you to an isolation in the healthcare facility. This is very important. We needed to isolate all those people who are showing signs of Mpox. This is very important for protecting the community from further spread of the disease.
You understand that we are very soon will have a conference, big international conference in Tanzania, and we need to have to ensure that these are going to be for all our attendees. If they feel anything, they will have to have a safety officer to isolate them with the Ministry of Health of Tanzania.
That is very important.
Yes.
And actually, our medical team, is vigilant. And we are doing also tracing cases. We have controlled our entries through our borders.
Yes.
And up now, there is no any case in Tanzania.
Fantastic, 0 cases. So do you do screening in the airport to see if the people have any symptoms?
Actually, our health team is at all ports of entry. They look for possible signs.
Yes.
And also, those who are showing signs, actually, they will be controlled by our health officials.
Very good.
We have our internal guidelines on how to do that.
Very good, very good. The most important things for our viewers at the moment in social media, you know, the infection happen from person to person by touch or on the surfaces when the lesion bursts. Okay, so this is for the people we meet in public, in the airports, in this. They use our stuff, for example, like you are in the aeroplane or driving transport or something. So that lesion when it's burst, and this is very obvious. You can see, you can know it by your own eyes if the person had lesion, because it will be in the face, in the hands, and so on. So you refrain from touching at the moment and say, sorry, you have to be not out. You can address that also to the health officials, Ministry of Health, so they can protect yourself and your community. But before that, when the symptoms is still appearing, like the swelling of the lymph node, the temperature, and all this, you will not know. It's not going to be appearing on the person, but then he is not going to be also, the infection will not be by touch and by other things, maybe through sexual intercourse or kissing, like you said, anything that can have mucus to mucus or something like that. Am I correct? Yes.
Yeah, you are correct.
It's not going to be a risk on a person you don't know. Okay, so for
Yes.
example, meeting in a public place or something like this. So thank you very much. This is very helpful also because it
Yes.
will help us to put
Maybe
our...
one more thing.
Yes.
Yeah, one more thing is that you could see that ministries of health across Africa and in the world, they have taken long because now there is no any questionnaire at the point of entry to assess the health status of travelers. But it is very important to ask travelers on the symptoms, whether they feel fever, chills, swelling of lymph nodes, if they have rashes. So they need to fill the forms. And also the health control officials at the point of entry needs also to receive these questionnaires for tracing some of the patients. For example, those who are experiencing swelling of the lymph nodes, they need to be followed up. So if we don't do that, we can miss some of the cases in the incubation phase.
Yes. Tab, can we develop a questionnaire like this for our next conference?
Yes.
Tanzania?
That is very important.
Yeah, I will.
And I can do.
My team will follow up with you with regards to this questionnaire. So we know that our attendees and the people who's coming are symptoms free.
Yes, I will be glad to assist.
It's very stressful. Really, it's very stressful. The whole thing, you know, like we don't need this at the moment. Anyway, thank you very much, Dr. Hamisi. So, Dr. Bismark, do you want to add anything with regards to the symptoms, infection, and all this?
I mean, I think Prof Hamisi has said a lot already, and you've actually added some more. I mean, so the means of spread is mainly from animals to humans. But if it gets into humans, then you can spread from one human to human, mainly through contact, like you said. I mean, more intimate contact. You can have some droplet infection, but usually these are people who are supposed to be very intimate. You know, that's why sexual intercourse or people who are very close could also get infected. But thankfully, again, if you compare smallpox to monkeypox or Mpox, the transmission between contacts is about 8%. Unlike smallpox that could go up as high as 30 to about...
Contact means touch, hand to hand or skin to skin,
skin to skin
service.
Yeah, so as long as the person has these lesions, like Prof said, as long as they have lesions, unless the scab over the lesions are falling off. So when they start having the skin lesions, they could be infectious for up to even 21 days after the skin lesions come. So everybody who has these skin lesions is advised to be in isolation for 21 days minimum before they go out. So if you can, so there's certainly a need for surveillance, screening of people, so that as soon as anybody is noted to have the Mpox, they are quickly isolated and managed. Because if you isolate them and you are managing them, the risk of spread to other people.
Yeah. Is this lesion, doctors, and you can answer me or any of the panel, please answer me. Is this lesions can be treated after finish and does not leave any scars or anything? It's a very female question.
Yeah, so one of the complications is that you could have scarring. Unfortunately, you could have scarring after the skin lesions have healed. That's one of the complications. But usually these days, it's for Africans, because we have a lot of, there's a risk of developing a lot of scarring. It's higher in probably an African than Caucasians. So
why?
Yeah, it's just because of usually in Africans we have a higher risk of developing fibrosis and all that. So usually a higher risk of developing scars as compared to other skin colors. But the scarring is certainly a concern. I don't know off the top of my head the percentages, but scarring is always a concern after you
Can
develop.
anyone of the professor can tell me, is after the treatment of the Mpox, is the scars, I mean, you know, like scars like inside the skin, does it appear or it's not necessary? I need answer. Anyone has any answer about this question? Dr. Hamisi?
Maybe can you repeat the question? There is
I am
part of
asking
it, my
about
internet is
the lesion after treatment and after recovery. Does it leave scars?
Actually, after infection, once the blisters have burst and it developed a scar, the remaining lesions, first of all, they are not infectious.
Yes.
The remaining lesions, but these lesions, they fade with time.
How long?
With time, yeah, they fade with time.
Yes.
So those spots, they are not permanent. They keep on decreasing over time. So with the use of body hygiene mechanisms, washing, and applying normal lotions,
And
they
scar
keep
creams
on
and all this,
fading.
it will fade like any like burn or scar or anything. It will fade. It doesn't have this.
Yes, yes.
It doesn't have
These
this.
are normal scars.
Yeah, a normal scar, like the acne, like all this.
Yes, like acne.
Yes.
So they can disappear with the use of some lotions, some ointments. So this one, technically, they are not permanent. With time, they will disappear. All
Thank
of
you
them.
very much in behalf of all women across the world. So this is a good answer. This is very important. So I would like to ask Professor Obina. We developed a guideline for our meetings and conferences, stating that no shake hands, no touch with any means like kisses, hugs when we meet, and also no using any personal items. And we will have, everyone has his own alcohol sanitizer with them to use it frequently and also to use it on the surfaces. And we also have the ultraviolet wand that we can sanitize the whole services and the sheets, towels, you know, table sheets, everything with it before we use it. Is this enough, or we need to do another safety and protection guidelines for our events and conferences? Because obviously we're not going to stop, we are going to continue, but we want to be providing the full protection.
Yeah, so I mean, those protective mechanisms are good, but for them to work, we also need to do a lot of public awareness. You know, that people understand why they are doing so and why they are useful. So, I mean, what I found lacking in Mpox compared to COVID is almost very minimal public awareness campaign amongst health workers, amongst scientists, amongst the people, the consumers, the normal people. If you have a conference, a lot of people who are going to be in that conference, support the conference, are artisans, you know, cleaners, cooks, and all that. And the level of awareness is low. So
you provide a little bit of training for them before.
Training and the health education.
Yes.
Billboards, pamphlets, you know, so even in a conference, you have all those things, all the sanitizers, don't shake hands, but we also need a lot of information. Risk communication should happen so that everyone from taxi driver, they all know the risk involved and what they should do. So I think that is what is lacking now in this as we try to respond to Mpox, the human angle of
Definitely.
creating awareness.
I mean, when you are concerned about it like us now, because we have knowledge, we take care. And yes, definitely this, we have also awareness leaflets and roll-ups to be there, and the training for the workers and the employees and the people at the hotels and at the airport. It will be very important. Dr. Hamisi, do you think so? We have to train the airports during the conference, the airport employees, the hotel employees, the people who will be engaged with us in the conference for the 2 days, since we have people from 70 countries.
Yeah, thank you very much. Actually, I like this question. Is very important, and it is a primary way to control and contain the infection. But an important part, we need to start from the household level. In the household, normally it is important to give education to people on how to disinfect touchy surfaces at home, because this is the primary area for the control of infection. What can be done at the household level? It is very easy. Normally, if you walk through households, you find that they use bleach to clean some surfaces like the toilet and other things. But the bleach is a very efficient microbe killer, microbes killer at the household. So with the proper dilution of the bleach.
Bleach,
The bleach.
chlorine.
Yes, chlorine.
Yes.
Yeah, the household chlorine is an important disinfectant for the household. With the proper dilution, it can be used at the household level to clean all touchy surfaces, door handles, window sills, tables, and surfaces.
Better than alcohol.
Create a
better than alcohol, 75%.
Yes, alcohol is the second. It's the second chemical to be used in the household. But the primary chemical,
chlorine,
which is very important,
the housewives
chlorine.
Listening to us, chlorine everywhere, bathroom, kitchen.
Yes, the household bleach.
Yes, and the clothes,
very important.
Chlorine washing. There is chlorine for colored wash, and there is chlorine for white wash. So you can use it also to wash the sheets and the clothes and everything. I have received a question from Egypt. From Amira Samara, saying, has it spread in Egypt, corona, and Mpox, and is it possible to become an epidemic like corona? Anyone can answer this question?
Now I will come to this question after I finish the cleaning.
So
in the household, we start with the Okay, I've received the question, but I will respond to part of it. Now, after the household cleaning with the bleach, when walking outside the household, everyone needs to have an alcohol-based sanitizer with the 70% alcohol, but with an addition of hydrogen peroxide to completely deactivate microorganisms. Hydrogen peroxide is very important in hand sanitizers. That is where you have assurance of deactivating all microbes in your hands and on touch surfaces.
Is it ready, I mean, to buy it from outside, or we have to mix it ourselves?
No, hand sanitizers also have a combination of alcohol and hydrogen peroxide. When it comes to airport workers, first of all, they need to be trained on the risks of touchy surfaces, because touchy surfaces are important in the transmission of infectious diseases. And also, the skin-to-skin contact you can avoid easily because you can see and you are conscious.
Yes.
But with the touch surfaces, you know you are there, you can touch the elevator handrail. That is where an infected person have touched it before. You are there with the infection. So all airport workers should be trained on how to clean all touch surfaces, elevator handrails, whereby travelers normally touch, cleaning touch surfaces on the seats, whereby travelers sit on daily basis, and also when signing print analysis, the first person who was analyzed for fingerprints, if was infected, then all other people who will use the scanner, they will get the infection. So we need to train people that after you have scanned your fingerprint, you need to use a hand sanitizer immediately to deactivate all microorganisms.
I will bring it with me and then sanitize it before I touch it myself.
Yeah.
Yes, this is
Come
important.
again?
I will bring the sanitizer with me. I'm not touching anything until I kill it first.
Yes, you hand sanitize, but when you touch the fingerprint scanner, if there are infection, you can be protected, but it is very important after you've touched it, even to sanitize again, to make sure that you are completely protected.
Yes, bravo. Very good.
That is very important, and we needed to train airport workers on personal hygiene and the environmental cleaning to make sure that they protect themselves and they protect travelers.
I read also that the ultraviolet, you know, when you go to salons and everything, then they put the brush in ultraviolet. The ultraviolet won't like stick. You can sanitize with it. It takes 3 seconds, and you can go to all the services and the towels and all this, the chair and everything. For example, in the aeroplane, you're sitting on that chair. How can you sanitize it? Really, it's impossible. But with this, it can be easily 3 seconds. It can be at least kill.
But after the passengers have alighted, normally you can see that the cleaners enter the aircraft and they do cleaning. That is the moment they can use chlorine to sanitize the touch surfaces in the seats which was used by travelers. And all touch surfaces, they can be wiped with a wiper which was previously soaked in chlorine. And that can ensure safety of boarding passengers in the same aircraft.
But the fabric of the seat, you cannot clean it. It has to be with something because you are sitting on a fabric. The seat is fabric. So this ultraviolet,
it can be sprayed with the chlorine fumes.
You can
ultraviolet.
It will be better.
Yeah, you know.
Yeah.
Ultraviolet is very efficient, but the challenge is on the devices and protecting operators. You know, yes, how are you going to because if you have a portable ultraviolet equipment, taking it inside the aircraft, it will be very efficient to sanitize the seats and all touch surfaces in a very short time. But make sure that you have protective clothing to protect the operator.
Yes.
And those equipments, I don't know if they are available at the moment, because at the moment,
it's available on Amazon.
We have stationary.
It's available on Amazon at the moment. Ultraviolet wounds, and it's not expensive.
Okay.
So
okay, that is very important.
Yes.
Okay.
Yes, we can get that one at least because the virus lives for 3 weeks on services.
Yeah.
Corona was the virus died quickly on the services. I think it was like 40 hours or something. But this is 3 weeks, and when it's fabric, it goes inside the wound and all this. I don't know, or live on the surface also for 3 weeks. it's too long. And
Yeah, with the fabric, you either use the ultraviolet radiation or make chlorine fumes.
yes,
You can spray chlorine fumes to the
wash it
fabric, yes.
in a very hot
Yes.
water if it is like something to yeah. Anyway, too much work.
So
But
now we need also a guideline for airports, how airport workers can protect themselves and how they can protect the travelers. This is
Yes.
also another important area for the control, not only for Mpox, but also for any other epidemic disease, any other contagious disease.
I know. And we are not lucky because we have to travel a lot and
Yes.
yeah, unfortunately. So
Now let me come back to the question.
yes,
Whether
of
Mpox
Egypt.
can
Yes.
result into an epidemic disease.
Yes.
Actually, Mpox has a potential of an epidemic disease.
What is good news?
And it is among, yes, it is among of the epidemic diseases which are easier to control.
Yes.
Once we improve water sanitation and hygiene principles, we are there to water sanitation and hygiene principles. This is an easy disease to control and keep it at bay.
Yes.
The failure of water sanitation and hygiene at the household level, at the community level, then this is going to be an epidemic disease.
And this is, we're not sure because you cannot really control this in the rural areas and places you cannot reach. Is it correct?
Actually, even in the rural areas, because I've been working even in the rural areas to promote water sanitation and hygiene, and we introduced quite a number of interventions. I know rural people are recipients, and they are good listeners, and they like practicing.
Very good.
So we can reach them through education and supplies. You know, not only giving them education, but we need to provide what we can call hygiene kit.
Yes.
In a hygiene kit, we need to promote the use of alcohol-based hand sanitizers, the use of household bleach in the control of infections, and the use of very simple chemicals like the baking soda, sodium bicarbonate.
All right.
Yeah. Instead of chlorine, we have the baking soda. Okay. We used to make buns. So the baking soda is very effective in deactivating microbes on human skin. And that one can be added in bath water, lukewarm bath water added with sodium bicarbonate is very effective in deactivating microbes on human skin. Another important salt is Epsom salt, magnesium sulfate. Taking bath with magnesium sulfate salt added in water deactivates quite a lot of microorganisms on human skin. Also, right concentration of potassium permanganate deactivates quite a lot of microbes on human skin. So, giving this knowledge to rural areas dwellers, first of all, we clear quite a lot of dermatological infections disturbing people. At the same time, it creates a barrier for infection. If somebody have touched a person and is infected, and this person takes bath with sodium bicarbonate or magnesium sulfate water, viruses which have not yet penetrated inside the skin, they will be deactivated and the infection will be stopped. So we need to give this knowledge to our people on how they can prevent themselves from Mpox and other contagious diseases.
Yeah, it is even important for us, not in the rural area, because now Epsom salt and sodium bicarbonate hydroxyperoxide with alcohol 70%. This is all new information for many of us.
Yeah.
And it is really easy to use chlorine in the house. So I think all the housewives that listening to us, or all the people listening to us, we live in homes. So it's actually, we can have this information and use it. For your body is Epsom salt and sodium bicarbonate, which is already there all the time. Hydroxy peroxide, which is being used for the hair, it can be used with alcohol 70%.
Also, potassium permanganate is readily available in all drug shops. And I know people, they are used to chlorhexidine. Commonly, we talk of Dettol, which is available all over the world. Now it is important to make it a habit. Using these barriers in bath water.
Yes. There is a question for Congo. I'm not sure if they are there or not, but someone can answer me this. Is the vaccine, we heard the question comes from Ambrosine Memedi from DRC Congo. She's asking, we learned that vaccine will be deployed in DRC Congo. What is about this? Is it true that there is a vaccination will happen in DRC Congo? Anyone can tell me the question, the answer, please. If Dr. Mangala is not here because he was not there, do we have any information about this? Please feel free, anyone can answer me from our panelists. No? Nobody knows about this?
Well, I believe that I think just a few days ago, some of vaccines have recently been deployed.
For me, the vaccination that I'm aware of is...
Please go ahead, Dr. Samuel.
Yes.
Sorry, I was just saying that I'm not aware of vaccination for DRC. I know that some vaccines were being delivered to Nigeria, but strangely, I've not heard that a vaccine is being delivered to DRC, and that's where they are needed most. So for me, it's
the vaccine which is delivered in Nigeria, is it for Mpox specifically, or it is for smallpox?
Yes. The vaccine that was being delivered to Nigeria was for smallpox.
Smallpox, which is the normal vaccine.
Not smallpox, but for Mpox. There's some. Yes. So
who developed it?
The same question. There are some vaccines for Mpox that have already been developed that are being hoarded out there because this is not the first time you're having the outbreak of Mpox. Mpox has been there before, and some countries develop vaccines. And even me, maybe I can ask our colleagues, why are we sending vaccines to Nigeria and not to DRC? What is the logic behind that? That's a question also.
Dr. Rasha, I think I looked it up. So apparently the European Union is supplying about 100,000 vaccines to DR Congo today. And I think in a few days, they're going to supply some more. So, I mean, I think the DRC and Nigeria had actually already applied to the WHO to get some of these vaccines, but the European Union is delivering about 100,000 vaccines today.
And why this vaccine is not available for everyone who wants it? I mean, even if it can be paid for, if people who can afford it, for example.
Okay, so I think until quite recently, these like Mpox has been quite limited to DR Congo and a few countries in West Africa. So usually producing these vaccines has a lot of economic issues associated with it. So if it's not a widely distributed disease, it will be difficult to produce large amounts. But thankfully, because there was an outbreak in 2022 and 2023, currently countries, especially like Dr. Samuel said, some countries in Europe especially have hoarded quite a volume. So if they are willing to give it to DR Congo so that people are vaccinated, that will certainly be helpful. But I think that the WHO is also taking steps to make these vaccines available in DR Congo and West Africa where it's most needed. So there are a lot of issues when it comes to these vaccine issues. Thank you.
And I
Yeah.
feel that the right solution is to keep this available for people who can pay for it, and the money that they get from the people who can pay for it, it can be used to provide the majority of the people who cannot pay with the free vaccine. So I mean, like equitable pricing, because I'm sure there's a lot of people who's traveling, who's healthcare providers, who's governmental officer who can actually pay for the vaccine. Or covered by the government, and then from this money it can cover other people anyway. But at least it's good to know that there is vaccine for Mpox specifically, because this is new for me.
I just wanted to clarify something. The vaccines that have been pre-qualified by the World Health Organization are the Genus vaccine and the ACAM 2000 vaccines. These are vaccines that were primarily developed for smallpox, but were seen to have cross protection against monkeypox. We don't have any specific Mpox vaccine that's currently deployed in the field or being used. The ones that Dr. Bismark mentioned that's being deployed actually today or being released by the European Union and is starting to be released in the DRC today is the Genus vaccine. And this Genus vaccine is produced by this company called Bavaria Nordic. So I think it's, again, Rasha, I think you raised a very important point that this issue of global health equity and the recognition that a disease in any part of the world can be a threat in any other part of the world. So we shouldn't be, I don't think that diseases should be determined by how much a person or a country can afford it, but we should recognize increasingly that a threat or a disease in the DRC can be a threat in Germany, can be a threat in the US, can be a threat in other parts of the world. So I think that's a very important conversation that needs to happen around global health security and global health equity, and how we equitably distribute vaccines and countermeasures that are available.
Very good. So the vaccine is available now is the smallpox, and it is cross prevention, cross protection. It's not
that's specifically the Genus vaccine.
Yes.
Yeah, too.
But this is what I read. I read that there is no specific vaccine for Mpox, but it is a vaccine for the whole family, like smallpox and stuff.
That's correct.
Yeah, good. I hope this will change very soon. So with regards to the question of Egypt, is this anticipated to be like Corona anyway, anyhow, or it's like you say, it's self-limited if we can take care of the... Are we at risk to have a lockdown?
I think it's unlikely that we'll have a lockdown. The mechanism of transmission is different. The COVID-19, as you know, is more aerosolized, more respiratory kind of disease. So it spreads a little. The mechanism of spread is a little bit different. Mpox requires close contact. So contact, whether it's human to human contact or contact with animals. So that's a little bit more difficult there. So the transmission dynamics is very different. So I think it's going to be unlikely for us to have a lockdown because of Mpox. So the transmission dynamics is a major factor. But I think that it's important for countries to build very robust and rigorous surveillance infrastructures, because what we don't look for, we cannot see and we cannot quantify.
Definitely. The other question was very important for all our panelists. How long after the exposure to the infection do symptoms appear? So the incubation period, in a sense, for example, someone has been infected today by anything, service or whatever. When the symptoms will start to appear, and what is the early symptoms, and the whole cycle for how many days? Please feel free.
I can take it. If any of the other panelists want to jump in, that's fine. The incubation period, which is the time from when a person gets contact, and to the first sets of disease, ranges somewhere between 5 and and 21 days. There are a little bit of outliers there. There are people who've had disease a little bit sooner based on the epidemiological data from the World Health Organization. Some have had it about 3 days. Others have had it a little bit longer, but the range is somewhere around 5 to 21 days that we can expect.
21 days incubation period after your exposure to the virus?
Yes, yes. So the time from when you are exposed to the virus to when you begin to develop clinical symptoms. And the clinical symptoms vary. Sometimes it starts with just a prodromal phase where you have like flu-like illnesses, and then it could evolve to rashes and lymphadenopathies and some of the things that Professor Hamisi mentioned earlier today. So the range of symptoms vary. And also there's a distinction. People who are immunocompromised, people who have HIV and other immunocompromising conditions tend to have a much different clinical clinical profile. So, and I also wanted to just point out.
No, doctor, 1 minute. No, I want the symptoms of the normal infection. We will go to the immunity compromised people and more. What is the common symptoms and how it appears and how many days the patient would suffer until he recover?
Yes, once a person has contacted the virus, usually it starts with an initial prodromal phase. And this prodromal phase could be just having headache, a fever, and then that would evolve to lymphadenopathies and then the small rashes. And again, depending on what specific clade, because it's been noted that some of the clades have a very distinct distribution. The clade 1 or the clade 1b that we've been talking about, clade 1 and clade 1b, tend to have a more centrifugal presentation or distribution of lesions. So the lesions tend to be more on the face, the extremities of the hand, etc. Clade 2b is a little bit different because it had more of an genital presentation. So the lesions were more, I would say, centripetal. So you had more lesions around the genital area. And again, as we know, it was sexually transmissible. So the
1 minute, dear doctor, 1 minute. We have to be slow so that people can hear us from the social media. Is the B, which is in the genital, is this the one we are having now, or you're talking about the other one, the one in 2022? Because you say 1 and B. So the one we're having now, that it's an issue now, is the one who has the lesion on the genital area or the face?
No, it's the one that has the lesions on the face. And
Okay.
that's specifically clade 1.
Yes.
So what we had in 2022 was clade 2, and that was more anogenital. And
Yeah, we'll leave that one at the moment, and let's focus on what we have in the issue now, so people don't get confused. So the issue now is this one, and this is the lesion on the face and extremities.
Yes.
And how many days the lesion stays until it's burst?
It can last for as long. I think Dr. Bismark talked a little bit about this. As long as the scar is still there until it fades off and the scab falls out, a person can be infectious. So the lesions can last for up to 2 to 4 weeks. It really depends. There's been a wide range in terms of the duration of those specific skin lesions. But characteristically, the disease would begin with a prodromal phase, which is people would have things like a fever, would have things like a headache, etc. Lymphadenopathies, where your groins or things could be swollen and things like that. So the clinical manifestations tend to follow that typical pattern or evolve into other things.
Okay, great. Thank you very much. Professor Hamisi? Professor Hamisi? Yes.
Yes.
Hi. If you want to tell in a simple
Hello.
way, yes, if we want to say in a simple way that people in the rural area and social media listeners and viewers can understand how they know that they got the disease, what is the first symptoms, and after how many days in incubation period from the contact person? In a very simple way that everyone can understand.
Thank you very much.
Yes.
We normally educate rural people on disease incubation.
Yes.
And normally we tell them that once a person is infected, will remain asymptomatic And during the symptomatic phase, which for this disease is between 5 and 21 days, there will be a fight between the soldiers,
Yes.
which we call them body immunity,
Yes.
and the infectious agent. And the result of the fight, the invader can be defeated by the body soldiers. That is where you don't even feel that there was an infection.
Yes.
But if the soldiers in your body have been defeated by the invaders, between 5 and 21 days, you will start showing this for the Mpox. Starts with fever, fatigue, body weakness, then the swelling, painful swelling of lymph nodes. After painful swelling of lymph nodes, what follows is the appearance of the lesions.
Mm-hmm.
Now, the rashes, not lesions, the rashes at that time, which they are fluid filled, and after development, during rupture, what is released is pus. And that pus contained in the fluids contains billions of infectious agents. And these infectious agents, they can infect people, they can infect clothes, they can infect touchy surfaces. So this is also an opportunity for disease prevention. We are teaching them that once they develop the blisters, the rashes, this is an important time to be taking bath with sodium bicarbonate, the baking soda, magnesium sulfate, the Epsom salt, or potassium permanganate. Once the ruptured rash, actually the sodium bicarbonate, it will destroy the microbes, prevent infection to other people, prevent infection to water sources, because the infectious agents, when they get to water sources, they will infect water sources. Other people will draw that water for drinking or for washing, they will be infected. When you are using these salts, you are creating a barrier of infection to other people. So you are protecting other people from getting the infection. Thank you.
The virus, thank you very much. This is very, very important answer. The time between the first symptoms and recovery, how long?
Yeah, it all depends on the body immunity.
Average.
But yeah, average is 14 days. We see most of people, for example, we are following up the scenario in the Democratic Republic of Congo. People are suffering. There is no real treatment, but it depends on the immunity to fight and suppress the infection. And in a span, depending on the level of immunity, some people recover within 7 days, but quite a number of people recover within 14 days. But some people goes up to 21 days, struggling with the scourge.
What is the medication we give them? I know that virus does not have, but there is some antiviruses that use for herpes, or Tamiflu for flu. So there is some antiviruses. Are we using any antivirus when the person is infected?
Yeah, our colleagues in the medical team, they are struggling. But up to now, we are following up what is happening from the Democratic Republic of Congo. And this is a learning phase for most of us. We are following closely because I thought previously they can use even acyclovir. Acyclovir is an anti during the outbreak of similar diseases. And also there are newer antiviral agents. And what we are seeing, more than 90% of people can recover without medication.
Yes.
And those who are they succumb the serious disease, what we are seeing, it is very important to lower fever, because fever is a danger sign. That is where we lose a lot of people. And with those presenting with high fever, the use of paracetamol and other non-steroid anti-inflammatory drugs have proved to be life-saving. Also, the use of antihistamines, also showing to
Rush and all this,
to reduce the itching. So there is quite a lot of efforts which are being
that combination of treating the symptoms.
to manage the disease.
Yeah, so we treat the symptoms. You mean that more than
yes, and sometimes also we are seeing the use of antibacterial agents, the antibiotics,
because
to prevent
secondary infection. Yeah, secondary infection.
Yes.
Totally. So at least we have like a protocol of treatment. We need to have a protocol of treatment to be ready, doctor, for our conference, because this is very important. That if in case we have any case, that we have to have a treatment protocol for them.
That is very important to develop a treatment guideline for Mpox, which can be shared across Africa and the other countries.
Maybe as well, our doctors and professors from other countries who has cases can also share with us what is the guidelines they have for treatment. Is Dr. Obina still here? Dr. Obina? Mehak?
Dr. Obina has dropped out.
Okay. So do we have Dr. Bismark? Do you have any guidelines that's been shared for treatment?
Yeah, Dr. Thank you so much again. And I think Prof. Hamisi has emphasized that most of the treatment of patients with Mpox is supportive. It's only a small percentage of these patients who have severe disease. Usually, if they have skin lesions of more than 100, if you count the skin lesions and they are more than 100, some guidelines will even look for more than 250 skin lesions and have end organ damage, whether they have some pneumonia, they have some encephalitis, then you need to use some antiviral agents. But currently in Ghana, for example, we don't have the antiviral that is recommended for the use of patients with Mpox. It's called tecovirimat. That is the drug of choice in patients with severe disease, but that is not readily available. So it's mainly supportive for now until the government is able to supply these medications. Thankfully, in Ghana now, we don't have any patients with Mpox currently as we speak. Yeah, thank you.
Thank you very much. Is Dr. Brian, do you have cases in Cameroon at the moment?
In 2024, we've only had 5 cases. We don't have, there are not a lot of cases.
We have also screened 5 cases here, and there is also, I think, 1 case in Egypt. What is the treatment guidelines you developed in Cameroon for this?
Yeah, so Dr. Bismark talked a little, and Dr. Hamisi talked a little bit earlier about therapeutics. Currently the therapeutics that are actually approved, have been issued an emergency use authorization, TPOX, or what is called tecovirimat. It's not actually readily available in an African context. It's a very expensive medication, and it's not.
What is the name of the medication?
Tecovirimat.
Tecovirimat, okay. And this is what they do, tecovirimat?
Yes, it's an antiviral that was initially built or developed for smallpox and was reused or repurposed specifically for Mpox because it has some antiviral capabilities against the Mpox virus. So it's a drug that has been repurposed. It was not originally designed or built for specifically for Mpox. But I want to emphasize that there was a clinical trial, a research study, a large clinical trial that was done in the DRC very recently, that was recently published by the US National Institute of Health, that showed that tecovirimat wasn't as superior, that supportive therapy, some of the things that Dr. Bismark mentioned earlier today, like wound cleaning, just supportive therapy in general is triumphs, is more important even than the antiviral in terms of reducing the duration of the symptoms, or at least the syndrome. So taking things like over-the-counter pain medications is critical. Some of the things that Dr. Hamisi mentioned and Dr.
Antihistamine, anti-inflammatory, and all these things, but maybe a combination of everything, as you said.
That's right.
Yeah, because you know, for a very severe flu like the swine flu and all this, the Tamiflu, for example, is antiviral. It's very much reduced the period of the virus existing, and there is also antiviral for herpes, like I think Valtrex or something. This also reduce the symptoms and the time of the severity of the symptoms, reduce the time of the symptoms and the severity. So maybe also this could be for people who can afford it and they can find it in their countries who are listening to us, because we have people from all around the world who are listening to us. It can be helpful to know that to check with their doctors in case, if God forbid, anyone had suffered Mpox, tecovirimat. Viramat. Okay, as antivirus. Great. So I would like, after the session, if anyone has a guidelines of treatment that it is ready, developed by the Ministry of Health in their country, please share it with us. It would be great to have it. We know the high risk group, of course, the compromised and the HIV and the older age, and also the children. So I think this is clear, and we don't need to go through this question. What test you can use to know that the person in front of you has Mpox? Is there any, especially in the incubation period? In the period between 5 and 21 days, do we have any specific test that we know that this guy is infected or this person is infected? Or like during Corona, we know. Dr. Hamisi? Or Dr. Brian?
Hello.
Yes, Dr. Hamisi. Is there any test? Yes, hello. Is there any test?
Yes.
Yeah, that the person is infected with Mpox, not anything else?
Hello.
Yes. Dr. Hamisi.
Come again?
Is there any specific screening test
Hello?
or test? Yes. Is there any blood test or any test that that this person is infected by Mpox and not anything else?
Oh, thank you very much. I think I don't have a straight answer at the moment, but I think our colleagues in the biotech might be having a test to distinguish between monkeypox and chickenpox and smallpox, because looking at the shape of the monkeypox virus is so different from that of a smallpox, and also far different from that of a chickenpox. And using the current research tools like real-time PCR, they can distinguish between these viruses, and even through the rapid tests, these viruses can be also distinguished depending on how the tests were constructed. But because I'm not an expert in this area, I'll leave this question to experts to provide the actual explanation.
Dr. Brian or Dr. Bismark, do you know the answer? Bismark
Okay,
and or Brian? Yes.
So usually if you should take, I mean, usually when they begin to have skin lesions and you can get some fluid from the skin lesion, if you do a PCR on them, the PCR will come positive for Mpox. And usually if it's I know in most countries now, even in Africa, they have labs that are ready to have that test. And in Ghana, we have it readily available in about 3 centers. So even right at our teaching hospital.
In the lesion, this is like at the end. Once he has the lesion, we know that he is
So you can do oropharyngeal.
Before when he starts to have the fever and all this, how he does know that, for example, he doesn't know a normal flu, he doesn't have a normal flu, because this is a flu-like symptoms. And I could have gone flu now and I will be dying from anxiety, not from Mpox, because maybe I have a normal flu, but I think I'm Mpox. I die before I even get.
Rasha. So you can do that as well. So you do a throat swab. You do an oropharyngeal swab. If it comes and it's positive, that means a person has Mpox. If you do a PCR on the oropharyngeal secretion and it's positive, that it has Mpox. But if it is negative, it doesn't automatically rule out Mpox, because if he goes ahead to do the skin lesions, develop the skin lesion. Then
forget about the skin lesion. The skin lesion at the end. I am talking about now. All of us can have flu now, normal flu. We were always scared this flu is corona or not. Now we're gonna be scared that this flu is Mpox or not. I want when I have a fever.
So just like the COVID, if you do a throat swab and it comes and it's
the foot swab is measuring if you have virus or not. And
no,
now
throat swab.
It could be flu virus, because it doesn't show specifically for smallpox. It gives you that if you have a viral infection or not.
There are PCR specific for PCR that are specific for Mpox. So if you do a
is there available? It is available.
Yes. Available in
Cameroon.
Yes,
most likely
for Mpox.
Yes, Mpox available.
I will ask about it if it's available in Dubai. Okay, it's okay. Swab, the PCR. Okay. So it can be done in the airport like it used to be in Corona time?
It has to be, not commonly. It has to be taken to a research lab, usually with a biosafety level 2 minimum. So it cannot be done readily at the lab. It has to be sent to a research lab.
Okay. It takes 2 days or something.
Yeah, it can take a while, Rasha. And what you're referring to when we had during COVID was rapid diagnostic tests. So what we have, as Dr. Bismark mentioned, is really the real-time PCR, and that can take a while to do. So we don't have rapid diagnostic tests that like we have rapid diagnostic tests for malaria and COVID that you can just walk around or carry around. So I think those are very important. But I think everything that Dr. Bismark said is absolutely right.
So I have received a question on Twitter saying, it's a question from Senegal, saying that during the period between the infection until the lesion come, there is a period. How long is this period when you have the flu-like symptoms and the swelling and all this? And can you control the virus before it is like giving the whole symptoms? And for example, from the first 2-3 days, I do PCR, I know it's Mpox, so can I take anything to limit it before it exhibit itself totally?
So I can take it, and maybe Dr. Bismark or Dr. Hamis, Professor Hamisi can take it.
Tell us and they will answer also,
Yeah, sure. So what you're referring to is what we call incubation period. So the time the person get exposed and then to when they have their initial symptoms. It's called incubation.
Headache and all this,
incubation period, like I said earlier, can vary anywhere from, there's a wide range. It could be anywhere
5
from
to 21,
5 to 21 days that you can begin to have this prodromal. It usually starts with prodromal symptoms, and these prodromal symptoms can last. When I say prodromal symptoms, I'm referring to flu-like symptoms like headache, fever, swollen lymph nodes, and things like muscle pain and things like that. And that can last for about 3 days. Then afterwards, for the next 3 days, that's where you can begin to have those eruptive skin lesions that can a person can have, and that can last for can last for 2 weeks, can last for. It really depends on a person's.
For this period, with the headache and the flu-like symptoms, will you be able to control the virus, for example, by tacrolimus or whatever is antiviral? You said so it can limit the virus before it's make all the eruption and all this stuff?
Yeah, antivirals in general are very effective when given early in the clinical projection of any disease. The earlier you give an antiviral, the easier it is for it to interrupt the replication of the virus. So sooner the better. But I also want to mention that tecovirimat, even though we are talking about it and it's known to be a therapeutic, it's not readily available. It's not a drug that you can easily just walk up to a pharmacy and just purchase and buy. It's a very expensive medication that was primarily stocked primarily for smallpox and never really has never really been used.
What company is doing it?
Come again?
Which company is doing this this one?
Tecovirimat, I'll have to double check on which specific company is doing that. I'm not sure if it's Gilead Sciences or one of I have to double check on that.
Okay. No, but let me tell you, if someone has access to it, will it make a difference?
Yes, so certainly it will make a difference. So there have been trials between those on placebo and those on tecovirimat, and it's clearly been shown that, like Dr. Brian said, it reduces the length of the disease, it reduces the severity of the disease. So if it's available, you can assess it, and
because as you know, why I'm saying that, it's about limiting the virus in any country. Okay, some countries does not have access to tecovirimat and they don't have access to PCR. They of course will suffer a little bit more. But for example, some countries have this. So maybe when they control the virus somewhere, it also will help to control it everywhere. So for example, there is 400 cases in Europe or something. So I'm sure they can have access to this antiviral while they're treating them. So maybe they can control it early enough so it will not spread further. Maybe they have access to this PCR, so they know early enough that this is Mpox, give this antivirus so they can control early enough and so on. So it doesn't mean because we don't have access to it, it's not available everywhere in the pharmacies that we don't talk about it. No, we have to talk about it. Maybe some people can make it available. Maybe people have access to it, so we can help everyone. What do you think?
Dr. Rasha, I mean, I think I completely agree with you in principle. If it is available and it's going to reduce the morbidity of patients and morbidity and mortality of patients, that is awesome. But these things also come with economic undertones, because the person who is producing the drugs would have to possibly have a way of recouping back their money and all that. So it's in principle, it's perfectly right. But as to its application, there's a need for a lot of advocacy to get that done. That would be helpful. If
like what happened with Corona, guys. I mean, with Corona, we had access to certain things, and so I think we need to know what is the best practice, and then we'll make it available. It will be available for some people who can afford it, and then it will be advocate to make it available for who cannot afford it. So it's always like this in everywhere. But we have to talk about it, not because only the accessibility, but also, for example, if someone can afford it. So I think this is very giving a little bit of relief that there is treatment, there is recovery, The fatality rate is very limited, as 5 to 10%, and it's mainly for the immunocompromised and the children, and so it's little, so we have to take care of these. So for me, for a conference, I am inviting people to attend. Do I have to ask the audience if they are immunocompromised, and do I have to provide a certain above care for them if they attended, or advise them it's better not to be traveling now if they are immunocompromised with any autoimmune disease, or in the category which is at risk, the risk category? What is the risk category besides compromised people?
So, Dr. Racha, so there's when you say immunocompromised, I mean there are several groups of patients. For, let's say, especially for patients who have HIV, if they are,
or autoimmune disease, it could be anyone on immunosuppressant medication. It's not only HIV. Yeah,
absolutely. But for HIV patients, if they are virologically suppressed, if their viruses are so down and you cannot detect them when you do a viral load, these patients are as good as, in quotes, any other person. So this person doesn't need to put in any extra measures, any extra preventive measures like any other person.
What about the people who's on immunosuppressant medication, like autoimmune diseases?
Yeah, so those on autoimmune disease who are on steroids and all that are certainly at risk as well. But again, if they are, I mean, they are well controlled, even though some people have autoimmune disease, they are in remission or they are well controlled. So usually for patients who are well controlled, even on immunosuppressants, they are actually not at a higher risk per se.
No, but if they are immunosuppressants, like they were at risk for corona, it will be at risk for this as well, because they are in continuous drug to make them immunity system suppressed. So they will not be fighting any infection. What do you think?
Yes, so I agree to that in a bit, but the challenge is that if there are ways of there are other preventive methods of so that you don't get the Mpox. So that being having an autoimmune disease and being on immunosuppressed should not necessarily put you at a disadvantage to do the things you are supposed to do. So if you put in the other preventive measures, that could also prevent you from getting the disease as well, so that we don't sort of, in quotes, stigmatize people because
no. They are the immunosuppressants that are at risk to be infected. We're protecting them, not we are at risk to be infected by them. No, I am just trying to protect them, because no need to make them be at risk. This is what I meant, but it's not stigmatizing them because they are not infected by now, but they can be infected. Like, for example, children, like older people, they might be at risk. Do you think we just take it as normal, or there is a specific things to take care of them while they are at the conference?
Okay, so I think Prof. Hamish may possibly give some further insight.
Okay. Thank you very much. Dr. Hamisi, for the risk groups and immunocompromised, like on immunosuppressant medication for any autoimmune disease, when they are now traveling and attending an event with many people, do we have any specific extra care for them, or we just deal with it as normal as the whole audience? Just to be
thank you
more
very
ethical.
much.
Yeah,
this is an important ethical question and also medical question. Those people who are using immunosuppressing medications, they are at an increasing risks of infectious diseases. And to protect them, they need to adhere to all wash in principles. For example, I talked about the Epsom salts. if somebody has an autoimmune disease and using medications which suppresses the immunity, is at an increasing risk of all infectious diseases. And most of the dermatological infections will also be part of the risk factors for him or her. So taking bath using Epsom salts or sodium bicarbonate or potassium permanganate should be an ordinary norm for this person to create a barrier of all infectious diseases which can go through contact with the skin. At the same time, the use of hand sanitizers should be not forgotten to him or her. Every time when touches anything or anywhere, must sanitize. I think if we are there to worship principles, this will help to save life and also protect others.
So we will make sure that they are aware of that they have to protect themselves with extra care, even than other people, because this is for their own good. And I like to take care of everyone who's gonna be my guests. So this is very important that like when you have guests, you ask them, are you sugar, I have diabetes, you want your meal with sugar or not, do you protect you from any allergy or not, and so on. So this is part also of the care that we have to provide for them. So they don't come to us very happy and leave very sad, you know? It's very important. So the other question I also received that as we know now, there is no specific test for the airport yet. So we'll have this idea of questionnaire, but currently in the airports, there is nothing to identify if the person who's traveling and entering the country has Mpox or not, correct? Or do we have something in place at the moment? And for example, in Ghana, in Nigeria, in Cameroon, do we have anything that in place for tests at the airport?
Thank you again, Dr. Rasha. I mean, like I think Brian has said it earlier. For now, we don't have rapid diagnostic tests that can be done.
Or anything, any like test or anything, except that observation by eye?
Yes, just observation, the healthcare workers at the ports putting the extra measures.
What about the temperature?
I mean, that may be helpful because if the person is febrile and you are concerned, then you can go ahead and get them screened. Yes, that could be helpful, yes, because the prodromal, they have fever, so yeah.
Okay, I think the options and then it's likely to leave. Okay, what is being done to combat Mpox in Africa? What's how I'm reading all the questions that have been sent, and there is a question that's already been said, so I will delete it. How prepare? Okay, what is the most misconception about Mpox? And for example, how can we effectively address this? For example, there is a misconception or fact, I'm not sure, that it is spread more between the homosexual community. Is it correct, or it is transmitted by sexual transaction even between female and male? How? This is a myth or fact?
Okay, so thank you so much, Dr. I think I'll start. So it's actually a fact that I mean it can be spread between males and females, but especially the 2022, 2023, it was mostly in men who were sleeping with men. I mean that was the major source of infection in that case, but it doesn't prevent it from spreading from men to females to men and otherwise. Yeah,
okay. Any other myth that spread about Mpox that people think about and it's not true?
I mean, I think what I've heard, another thing I've heard is that they think, is it as dangerous as COVID?
Yes.
I mean,
Is it?
people are beginning to do that comparison. I mean, give or take, because yes, you could have it spread through droplets. Yes, that is there, but so far it's not been shown to be as efficient as COVID.
Yeah,
you know.
because COVID was very fast and by
Yeah.
air and breathe and breath, and
It is
so
mainly
you can be like this between one and one and you get infected. So this was a really fast infectious, but this one you have to be together and holding hand or using the same things, which is also can happen. Very common. Because all what we're doing in public places and handles and left and all this is totally. So how does Mpox fit with the larger global? What can other region learn from African experience with Mpox? I think we said that as well. What are the most pressing question from the public? What is the most pressing question from the public about Mpox when you are in your community or people? What is the most pressing question? Dr. Hamisi and Dr. Yes.
Yes, so usually now the major concern is the availability of medications to treat people if they get Mpox.
This is what I told you. Yeah. Yeah.
So,
and you don't want to tell us because it's too expensive. And you don't, someone say it. Maybe it will come. Maybe it will be accessible. We don't know. Yeah. I mean, imagine. Well, we have to know. Imagine someone who is, can afford it. It's better to save one life than nothing. So, Dr. Hamisi, what is the most pressing question you heard about Mpox?
Thank you very much. Actually, the most pressing question stems from the worry of people. Some people don't believe that is an infection. You know, in rural areas, there are quite a lot of myths. Some people think it is a curse, it is witchcraft, and so forth. That is one of the myths which have developed. Not only even in the DRC, they considered in witchcraft in the first place.
Okay.
Another attempt which we have not discussed, actually traditional healers and the people in the community, they are also using available means, indigenous knowledge to try to combat the disease. Some medicinal plants have emerged to be of good help, like Anikia chlorantha. Anikia chlorantha is a medicinal plant with a higher antiviral activity, widely used in the Democratic Republic of Congo and West Africa for quite a number of viral diseases, and it has a promising antiviral activity which have already reported by various scientists, and it is useful and an important asset to conduct research on the usefulness of the antiviral compounds from this medicinal plant, because already in some publications, it has been reported to have an effect on hepatitis A to G, and already there are some products on the market in West Africa for the treatment of hepatitis using from this medicinal plant. And already people in villages in DRC and other parts of West Africa are using concoctions from these medicinal plants. They are also taking lukewarm bath from the concoction of this medicinal plant.
Lukewarm bath. Okay. So so it's been what? It's been approved or it's really there is an evidence that it's effective?
Yeah. This is a question on Mpox, but on hepatitis, there are proof that it works. But
Okay,
on
but for
Mpox,
Mpox,
we need
yeah.
the science to tell us if it works also.
Okay, please.
Yeah.
I mean, anyone.
There is no research which has
us.
been done on Mpox.
Okay, they
Hello?
will. I'm sure they will. I'm sure they will. I'm sure they will.
Yes.
So what are the best resources for channels, people to stay up? What do you think, where do you think the people should take their information, the information about Mpox? Do we have any specific place? Because we don't want to rely only on hear and say. There is any place that people can log in and know the information about Mpox? Maybe what WHO, maybe.
Actually, in Tanzania, we have a specific phone number.
Okay.
Whereby people can phone and ask questions, and the medical team organized an education session ready to respond. This is a 24-hour.
Yes.
There is for the call center, and if somebody sees some symptoms related to Mpox, can call through this number, and the medical team will organize a help for him.
Yes.
And also the website, for example, of the Ministry of Health in Tanzania for the health education part is advising people with those signs to call. They specify the phone number so that they can be helped. So in Tanzania, we have this system. For all infectious diseases, we have a specific call number whereby an individual will be helped by the medical team.
Great. This is very good. And I think it's available in most of the countries. Otherwise, they can log in any of the reputable channels on social media, like Ministries of Health channels or WHO. Doctors and professors, thank you very much. It was really helpful. And I learned a lot myself. And I have a lot of ideas that we can implement in our future meeting. And also some questions to ask about the vaccines and so on, to inquire about its availability in different countries, so we can see if we fit for it or not. But I'm really grateful for your time and the valuable information that you shared with us. It's really great. It will help saving many lives, I am sure, because all the information about prevention we mentioned, it can really save lives, save communities. And of course, with the early detection and the treatment and all the guidance that we mentioned. Of course, we have also, don't forget, all our live stream audience and viewers. Don't forget to follow us and share with your community this live stream so everyone can benefit from the wellness of and the wealth of the information of our professors and the African experts in infectious diseases, and all what you need to know about Mpox, prevention, symptoms, and treatment. Other than this, I would wish you all very good health and luck and success in your life. And I'm sure that this is gonna go away like other things went away with very limited damage. Just be careful, take care of yourself, your hygiene, the water sanitation, and the your body sanitation and protection, and all this until this go away, and I'm sure it will, as many other things happened before. Thank you very, very much for your time. If you have any question, you can drop it in the comments below, and we will answer it in a different occasion. I'm going to be listening to your questions, and if there is any specific question, I will reach out to our experts and get it. Love you so much. Wish you good health, good luck, good success. And thank you very much, professors, that lasted with me the whole the whole live stream. There's some people dropped out. Thank you, Dr. Hamisi. Meet you soon in Tanzania. Thank you, Dr. Bismarck.
Thank you.
And also
You're
Dr.
only
Brian.
welcome.
and all the doctors that are with us now. Thank you very, very much. All our alumni, media partners, viewers, live stream viewers on Facebook, Twitter, Instagram, and YouTube. Thank you very much. Bye-bye.
Bye.
Bye. Thank you.